This training is a walkthrough of a completed CMS 1500 outpatient claim form, also known as a HCFA 1500 form. This is a sample claim for training purposes, so none of the information we'll be using is real. Starting here at the top, this is where you'll put the payer's or the insurance provider's information. Their name and claims address goes here. If you notice, we did not use any commas or decimal points because the National Uniform Claim Committee, who designed this form, do not accept decimal points or commas. Box 1. This is where you'll indicate if it's Medicare, Medicaid, TRICARE, CHAMP VA, Group, FICA, or another type of claim. We've selected Group Health Plan because that is what most of your options will be. This includes payers like Blue Cross Blue Shield, United Healthcare, and Cigna. For this example, we've entered ABC Healthcare. In Box 2 goes the patient's name. The instructions direct us to write in a last name, first name, middle initial format. If there is no middle initial, just leave it blank. In Box 3, we've entered the patient's date of birth and sex. During this demonstration, we won't necessarily go in numerical order because when you're billing an electronic system, it won't be numerical like this. But what's important is that the information is input correctly. Going back up to 1A, we entered the insurance company, the insured's ID number, and the subscriber. For this example, Jane Doe is the spouse of Daniel Doe, and Daniel is the owner of this plan. If Jane owned the plan, we could leave the insured's name and address blank because it would be the same. The address in Box 7 is the same for both Daniel and Jane. You do not have to put a telephone number. It's recommended to add the +4 addition to the zip code because some systems will not let you proceed without it. For example purposes, though, we've left it off. You'll also notice several fields reserved for NUCC use. Always leave those blank. In Box 11, we have Daniel's group number, his date of birth, sex, payer name, and plan. We've put ABC Healthcare, which is his insurance plan, and Plan Gold is his plan with ABC Healthcare. Box 10 asks for the patient's condition. Are they employed? Is this claim due to an auto or other kind of accident? If it applies, you will click Yes. 10B, State of the accident. If there's a third party, such as workers' comp, that needs to be billed, this information would be important to include. In Box 9, if Jane had secondary insurance, meaning she had another plan in addition to her husband's plan, you would put her additional policy's information here. 11D, is there another health plan? If we'd indicated that in Box 9, we would select Yes. Box 12 is for the provider's signature. Providers keep electronic signatures on file for documents that require signing when services are rendered. So we've entered signature on file and the date which the signature was filed. In Box 13, the same applies. When a patient comes into a doctor's office, they sign a release authorizing the provider to bill their insurance. In doing so, their signature is filed, so you'd put that the patient's signature is on file. Box 14, date of current illness, injury, or pregnancy. If it applies, you'd enter the month, date, and year. Same in Box 15. In 17, if you have a referring provider, you'd list their name here and their NPI in 17B. A referring provider is the doctor that gave the patient a referral to see a specialist. This is usually the primary care provider. We don't really use 17A, but if you want to add a qualifier or any other identification number for the provider besides the MPI, you can do so here. You can find those instructions in the NUCC 1500 Claims Manual found in your training materials. Box 16, dates patient unable to work. If this is a workers' comp, accident, or anything that puts them out of work, you can put the dates that they are out from and to here. In box 18, if they have any hospitalizations related to this occurrence, you'd put the date here. For example, if someone was hospitalized because they broke their leg, then had a follow-up with their doctor for it after they were discharged. Box 20, if any outside labs were done, you would select Yes. Then enter the charges. You are not billing the lab, you're simply letting the insurance company know that there were lab charges. Box 21, Diagnosis or nature of illness or injury. Notice here there is an ICD indicator. This is where you indicate if the diagnosis code classification is ICD-9 or ICD-10. Since we're using an ICD-10 diagnosis code, we entered 0. If we were using ICD-9, we would enter 9, just as instructed in the NUCC manual. And we've entered some placeholder diagnosis codes. Box 24E, Diagnosis Pointers. How many diagnoses are in box 21? Again, we are not using commas or decimals. And we're going to enter A and B because there is a diagnosis code in box 21A and a diagnosis code in box 21B. If we had entered 1, we would only put A. And if for some reason we filled them all in, we'd list A through L. Box 22, Resubmission Code. This we will cover in a separate module where you'll learn how to resubmit claims for adjustments. Box 23, Prior Authorization Number. This is if the patient's procedure requires the provider to have authorization. Each authorization will have an identification number, and you can enter that here. Box 24A, Date of Service. What day did the patient visit the provider? In this example, she visited 2 days, and as you can see, we have them both listed, and the from and to dates are the same. You cannot group dates of service. You can't put January 14 through January 15th on one line. You must list each visit separately. 24B, Place of Service. We've entered 11 for office. In your training materials, you'll find a place of service cheat sheet with all of the descriptions and codes. 24C, if there were an emergency indicator, you would enter that here. You can find those instructions in your NUCC manual. 24D, Procedure Services or Supplies, CPT/HCPCS. We rarely say HCPCS. You'll always hear HCPCS code. 99215 is the procedure code we've entered. It is a CPT code. We did not enter a modifier for this example. Modifiers are 2-digit or alphanumeric codes. 24 we've already covered. In 24F, we have the charges. We do not enter a $sign, but some systems will ask you to use a decimal point to separate dollars and cents. If your system requires it, then of course use it, but on the CMS 1500 paper form, you never enter a decimal point. It is very important to follow the instructions of the billing system you're using to ensure your claims are transmitted correctly. 24G, Units. How many days or times in a day was the patient seen? She was seen once January 14th and once January 15th, so we will add 1 unit for each day visited. 24J, Rendering Provider NPI Number. Here we will enter the NPI of the doctor that rendered care. It was the same doctor both days, so we've entered the same NPI twice. Box 25, we have the provider's tax ID. We've checked EIN here, but if it was a Social Security number, you would select that. Box 26, Patient's Account Number. This is the internal number that your provider uses to identify patients. This is not the information from the insurance card. You can also leave this blank. Box 27, Accept Assignments. We selected yes for this example, but you'd choose what applies as we covered in a previous lesson. Box 28, The total charge for both visits is $150, so that's what we've entered. Box 29, there is no other insurance company that paid money on this claim, so we've left it blank. If there were another insurance payer, we'd enter the amount they paid here. Box 30 is reserved for NUCC, so we've left it blank. Box 31 asks for the physician's signature, which again is on file along with the date. Box 32, service facility location. If the billing provider's address is the same address as where services were rendered, you can leave this blank. If we look in box 33, we see the provider's office is located at 123 Cakes Street, and the patient was seen by the doctor we indicated earlier at this address. If, however, Jane visited this doctor at an address other than this one, you would put that address here because the services were rendered at a separate location. And that completes the CMS 1500 claim form. As you continue your training, all of this will come together for you, especially as you learn electronic billing, because we rarely have to use paper claims anymore. Nevertheless, once you understand how to complete the paper form, you will absolutely understand how to bill electronically, because all claims require the same information. As always, you can find these instructions in the NUCC manual in your training materials. See you in the next lesson.